Welcome to Tuesday night, the Quees Inn. We're live with a studio audience. Thank you for stopping by. Don't forget, if you're watching this, share, subscribe, and like. There's a lot of great information we have on these videos. And keep videos like this aside because you will find our new advertiser. I'm going to let him introduce himself to the Rhode Island Wave Spotlight Series.
Dr. Jonathan Martin from Greenwich Bay Medicine and Blackstone Valley Medicine. We've got locations in both East Greenwich and Lincoln. It's a new practice. We opened in June of this year. The physicians there have been in private practice previously. We were out for a number of years, worked through corporate medicine, didn't find it was really the thing for us, and so we've gone back into private practice and reopened, and we're hopeful to provide services to the community around here in Warwick, East Greenwich, Coventry, West Greenwich, Cranston, North Kingston, as well as up north in Lincoln, Cumberland, Smithfield, North Smithfield, Woonsocket.
So there's about 712 people online right now that just said, great, he's got a doctor on there and he has no openings, he's not going to see me, so why should I care?
We have a lot of openings right now.
There you go.
So we're here to tell you that primary care is alive and well. Well, I don't want to say alive and well, but we're still here in Rhode Island, and we have plenty of openings for new patients right now. We've got 10 providers. It's a new practice. I don't anticipate that we will be open paneled for an extended period of time, but hopefully we're going to continue to grow. I think we're going to get filled pretty quickly because there is a big need for primary care in the state right now. But as we grow, our goal is to continue to grow. So from 10 providers to 20 providers to 30 providers, sky is the limit as long as we can maintain the practice.
And when you say primary care, obviously that's the quarterback, as I call it, for the doctors. You see people just regular annual physicals, some of the kids for sports. You see basically what's going on to try to keep the car running really well.
Yeah, the old term, jack of all trades, master of none, probably serves the description of primary care pretty well. We'll listen to any complaint and try to figure out what's going on with you. So it's important for people to have a primary care doctor because, you wake up with a pain one day or a rash or something that doesn't seem normal to your body, and who do you go to first? And instead of going to a specialist, which oftentimes requires a referral anyway nowadays, you go to your primary care doctor, and oftentimes you don't have to go much further than that. We handle a lot of chronic conditions, chronic diseases, elderly patients. We handle everything up to end-of-life care. But really where we shine is in preventative medicine. So if we can get people into the practice younger and get ahead of those behaviors and the conditions that creep up over time and get in front of those to prevent them from becoming chronic conditions that require multiple medications and specialists and all sorts of treatments. But yeah, a quarterback is a great way to put it too.
And a lot of the healthcare companies or insurance companies are really trying to get behind that theory of preventative. Some of them give your annual physical is no copay. Some of them have situations where, depending on what the health plan it is, you don't pay for some prescriptions because they're maintenance or are better preventative than not taking it. And this is where your team can really come in and explain where someone is in their situation and what might be best for them.
So a lot of what we do really is, promoting prevention of disease occurrence in people. And that starts with behavioral things, right? So you're mentioning no copays for your annual physical exam. So there are incentives to get into the doctor's office and get that annual blood work, get that physical exam, talk to your doctor, go over the things that you've been thinking about but haven't been able to have the chance to ask somebody about for the past several months. We find that those occurrences, when we see a patient in the office for that annual exam, whether it's an annual wellness exam with a Medicare patient or an annual physical exam with a younger person, those are our opportunities to really get into how are all the aspects of your life going. It's not just a visit for, hey, I've injured myself. Hey, I've had abdominal pain for the past several months with these other symptoms. This is a time where we really get to spend a little time with the patient, get to know the patient, develop a relationship with the patient, and start to learn about what's important to them. And we start to talk about, what can we do to plan for the next 10 years, next 20 years, next 30 years. I mean, the way you're going to feel in your next decade is how we treat ourselves in this decade. So the preventative stuff is really important, and there is some focus on it. There needs to be more. There needs to be more engagement, I think, with the patients from their insurance companies or however we do it to really get people into better behaviors at a younger age to prevent the things that can occur in older years.
When we talk about the different types of doctors at your practice, doctors, the typical path is a lot of schooling and then a residency in a hospital or some facility. And I imagine your doctors have seen a lot of different things before they become the primary care doctor.
Yeah, and primary care doctors are, like I had said, sort of jack of all trades. But after you start practicing for 10, 20, 30 years, you start to move towards some things that you feel really comfortable with. So out of the 10 providers that we have, we've got a number of providers that are very comfortable with orthopedic procedures, joint injections, PRP injections. We have a Botox provider. We've got a dermatology focused internal medicine doctor who does all our biopsies for us. We have a couple of providers that are very focused on insulin-dependent diabetes. They're very good at that. So even within the practice, we have people who sort of specialize in certain areas of primary care. My own area that I try to specialize in is sort of preventative health, especially cardiovascular health, preventing the diabetes, preventing the COPD, preventing the coronary atherosclerosis from occurring. That's really where I sort of like to shine, is getting people a little bit younger and trying to prevent the issues from creeping up.
And tell us a little bit about your vision from being a doctor and welcoming the door open with patients. There's just not enough doctors in the state. How did we get there, and is there an exit ramp where we could fix this?
Yeah, I sure hope so, because we're feeling it just running the practice itself. Recruitment into Rhode Island is difficult right now. It's very difficult to recruit new physicians here. Even prior to the pandemic, we had an aging physician roster in Rhode Island.
Sure.
There was a report in 2018 that placed us pretty high up in the average age of physicians here. The pandemic did us no favors in that it accelerated retirements, and it accelerated people going off into other states. And so we've seen a pretty consistent exit out of Rhode Island for physicians in general, specialists and primary care alike. So our physician roster has dwindled significantly. At this very moment, it's really probably not adequate to handle all of the patients in Rhode Island. There's a lot of people out there that are not seeing a primary care doctor right now because they don't know where to turn. I mean, we hear people, they come in to see us and they've made, 5, 10, 15 phone calls to various practices and no one's accepting new patients. And they're happy we pick up the phone. That's one of the things we do quite well, or at least we try, is we try to answer every single phone call with a human being. We're there right now. I don't know how long we're going to have open panels for everyone, but like I said earlier, as we get filled, we will try to continue to grow. Where we get new physicians from into the state, it's really becomes a matter of how well we treat the physicians in the state. Probably a conversation for another time.
Yeah, but a facility like yours, when you can see patients and people are really giving good ratings and they're saying, hey, I really like these guys. They've got a lot of specialties within their primary care. That may attract more doctors to your organization.
I think what attracts providers to our practice is the partners have been around Rhode Island for a long time. I've practiced exclusively in Rhode Island. I'm born and raised here, as are all the partners of the practice. Practiced here my entire adult career, and it's a small business. It's a family-run style business. So we have physicians who, if their kid's homesick from school, come on in. You can bring your kid with you and put them in the back office. We try to maintain a workplace that is really welcoming, and we really try to get the people that we've worked with for years, we've brought back a lot of them, and we've brought back the best. So we've got a very a nice, warm, welcoming practice, not just for the patients, which is obviously most important, but for the physicians too. So if there are any doctors out there that are considering either retiring, closing practice, they're solo practitioners, or they're thinking about, moving out of state, there are other options. I think that call us and we can see if we can bring the panel over and expand our practice. But yeah, we welcome people who want to practice medicine, who want to see patients, who really have the physician-patient relationship at their core. Those are the sort of providers that we're looking for. They're hard to come by. There's just not a lot of physicians around here.
But you feel that as a patient walking in. You feel you're not just a number. You're not just, oh, well, you're 20 minutes early, but don't worry, the doctor's an hour late. Where's your insurance card? Give me your ID. Without that at the front gates, it's such a more relaxed atmosphere.
Yeah, it's, private practice is totally different from corporate practice medicine. And I've been through a lot of iterations of it now. And private practice is really when the physicians have ownership of the organization, there is a distinct feeling in that practice where, customer service at the front desk, that comes first. You've got to answer the phone. You have to pick up and say, Greenwich Bay Medicine may help you. Do you want to come in and see a physician today? So that's the sort of focus that we put on things that I think does set us apart from, calling somewhere and it's just hit a button after a button after a button after a button just to leave a voice.
To find out they're on lunch.
That, what, it's funny you mentioned that. So one of the things that always bothered me so much about the corporate medical practices is that they would close for lunch. And I've always said, like, when do working people make the phone call to make their doctor's appointments? I call on my lunch break.
Yeah.
I would imagine most people do. So we do not stop answering the phones at lunch. You never will. That's the most important time to actually have the phones manned, because that's when people are making phone calls. And we try to make sure we take our breaks around it, and we make sure we have coverage on the phones during the 11 a.m. to 2 p.m. hours. Really important.
Well, because if you do the math of the clock, they call on their lunch to get the prescription so they could pick it up on the way home.
Sure.
Which, as we know, your similar staffing concerns around the state are at the pharmacy as well.
Yes.
And that prescription used to be an hour and a half. It could be tomorrow.
Well, nowadays it's, most people, and we hear all of this from the patients coming in, a day, 2 days, a week they're waiting. And it's not that the physician's twiddling his thumbs, playing games somewhere. The staffing is a real issue. Again, we're in a very good situation in our practice because we've been around for a while and we've brought people together that we've known for a long time. But staffing is a problem for a lot of the practices in the state. There's just not enough people to go through all the voicemails to actually get back to all of them. There's not enough physicians to go through them. Every refill request, you can't have a medical assistant do it. You can't have a front desk staff do it. A provider has to look at that, make sure that you're still supposed to be on the medication. Make sure that it's appropriate time for a refill. If it's a medication that could alter something like your electrolytes, when was the last time you had your metabolic panel checked? So, there is more that goes into actually reviewing just as simple as it sounds, a refill request. There's thought that goes into that, and you don't get paid for that part of the job.
Right.
So, and it has to be done by a licensed provider. It can't be done by just a staff member. So there are reasons for these delays that people are seeing. Sadly, I think they're correctable. I should say it's a good thing that they're correctable, but sad that they haven't been corrected yet.
Yeah.
But they're correctable by, there are some things we could do in this state to promote small businesses going back into private practice and making sure that they've got appropriate staffing. But we, Greenwich Bay Medicine and Blackstone Valley Medicine, we try to answer every single phone call. We're pretty good at it. We look at the numbers. We get about 4,000 phone calls a week, and we answer about 3,600 of them. So
it's amazing.
We're pretty good at it. Yeah, I answer the phone myself quite a bit. Actually, I keep a portable phone on me. If I'm not in a room with a with a patient, I answer the phone just like any other staff member would.
So if you call, what's the number? We'll say East Greenwich first.
The East Greenwich phone number is 401-398-0288. And actually, we'll keep it simple. You can call that phone number. You could book at either the East Greenwich or the Lincoln location.
Very nice. I like that. Flexibility.
Mm-hmm.
And one thing I just want to mention that your practice, I'm expecting, does a lot of is referrals.
Mm-hmm.
It's a key thing to say you've taken a patient to a certain point. Hopefully your preventive work has prevented more and worse issues, but sometimes it does happen, orthopedics or blood issues. I go to a neurologist for migraines. So, sometimes it has to go to a specialist. Talk a little bit about having so many doctors in your practice and the connections that you have to other specialists around the state.
Yeah, so we try to take a really traditional approach. We have a network of physicians that, again, we've been around here for quite a while, that we're comfortable with. And when the patient gets to a point where a specialist is needed, and that happens often, we know who to call. And getting into specialists, just as getting into primary care right now, is difficult. But we make sure, and again, the traditional approach is when the patient needs to be seen by a specialist quickly, we pick up the phone, we call our colleague, and we get on the phone with the colleague. We run the case by the specialist over the phone, get some temporizing measures that might be necessary. They can offer their advice to us. So the patient is sort of, whether it's blood work that they'd like to see when they show up to that visit, or some imaging, or just some early intervention on what they think is going on, we can implement some of those things early and get the patient over to the specialist. And that, again, that private practice connection that we have with our colleagues has been helpful, because we can pick up the phone and talk to the cardiologist, we can talk to the nephrologist, we can talk to the orthopedist or the general surgeon, and we can get them on the phone pretty quickly. We have most of our colleagues' cell phone numbers. So yeah, when those specialists are necessary, they're necessary. And when that happens, we make every effort to get people in the appropriate amount of time. It's no different in those specialties. There are delays much more than we would like to see right now.
Sure.
For the same reasons that primary care is a tough business in Rhode Island right now. But when patients really do need to be seen by a specialist emergently, we get them in. We try to avoid the high cost utilization places like the emergency room, because oftentimes you're not getting anything more in the emergency room than you would from having a physician who's able to pick up the phone, talk to their colleague, get that conversation started, and do things outside of the hospital setting to prevent the hospital setting in the long run.
So Dr. Martin, his doors are open for business.
Open for business.
A new advertiser on the Rhode Island Wave. We welcome you for the Spotlight Series. You're welcome to our advertising family.
Thank you.
And I would love to say that your doors will be open a little bit, but not a ton, when a lot of people hear this and see this and read this, that you're open for business and they want to get a new primary care or start a primary care relationship.
Sure. Yep.
And you'll start them at day one and see what you can do to help them maintain a healthy life.
I love that. I encourage everybody out there, be the reason we have to hire another doctor. So help us close our panel.
That would be a great motto. You should use that.
Thank you.
Fantastic. Thank you, Doctor, for coming.
Pleasure.
Appreciate it.